As we've been reporting, the pandemic has disproportionately impacted communities of color. And now those same communities are having difficulty getting access to a vaccine. According to a Los Angeles Times analysis, in LA County, 68% of Black residents and 67% of Latino residents have yet to receive a single shot. That's compared to 46% of white residents and 38% of Asian residents who are not vaccinated. LA County officials are calling the racial disparity disturbing. My guest is Amy Schoenfeld Walker. She's a graphics editor and reporter at the New York Times. Amy, welcome. Great to have you with us. So you recently published a report about the racial disparity and access to the vaccine. What barriers can limit vaccine access for some Americans, and is there anything being done to eliminate those barriers?
Sure. Great to be here. Thank you so much. Every public health official that we talk to point to barriers to access to the vaccine itself, as well as barriers to access to information about the vaccine. And we know from research by the Kaiser Family Foundation, as well as Sergo Ventures, that Black and Hispanic people in the United States are less likely than white people to have access to a regular or trusted healthcare provider. They're less likely to have health insurance and more likely to have unanswered questions about the vaccine. They're less likely to have internet access reliable enough to make an appointment or to have a work schedule flexible enough to find a time for a shot, or to take time off for symptoms. They're also less likely to have access to dependable transportation to get to vaccine sites. And there are some communities where there are real concerns around whether getting a shot might harm immigration status too. So officials are working really hard to remove those barriers, and they're focused on getting the message out about the vaccine through trusted messengers in the community, not necessarily, government officials, but local leaders, church leaders, community organizers, and to also make that vaccine more convenient, to make it easy to get, as easy as possible.
Right. And so for those numbers, how do you tease out those who are perhaps just hesitant to get the vaccine but don't necessarily have access issues, in terms of the numbers of people unvaccinated in those groups?
Yeah, we've been looking to polling from Kaiser Family Foundation. There's also the census has a household pulse survey that looks at sort of reasons why people haven't yet gotten a shot. And while there is certainly sort of a consistent share of the U.S. population among all groups, all race and ethnicity groups that say they are very likely to not get a shot, that group has been pretty stable. And there's this group in the middle, some officials were calling it the movable middle, that are either, still eager to get a shot, but have been waiting to see if friends get the shot or have questions and are waiting to see their, primary care doctor, or there have been barriers. They haven't been able to get to a clinic, or they weren't aware that there was a mobile pop-up clinic down the street. So this is a slower and more intentional process to reach this middle group. But we know that they're there, and polls consistently show us that there are people who are still willing to get a shot.
And so, Amy, with more states now making the vaccine available to younger adults and even adolescents, ages 12 to 15, how might this impact the racial vaccine gap? Will this move the numbers significantly, do you think?
Sure. Well, there's always been this expectation. Officials have told us that, as the vaccine campaign has moved along and opened up to younger age groups, that the disparities would close somewhat just because Black and Hispanic people in the country do skew younger. So there was this expectation that would happen to some extent. But beyond that, I think that polls show and community healthcare workers are sharing with us that they really do see an opportunity among young people of all race and ethnic backgrounds, and that they're hopeful that they can bring numbers up in communities by getting younger folks vaccinated.
And Amy, the headline of your reporting is the racial gap in U.S. vaccinations is shrinking, but work remains. So there's optimism there, right? The situation is improving. What in your reporting has proven to be the most effective?
You know, the White House specifically was pointing to Mississippi as an example, and the work that community groups did there to, bring solutions to the state, and pointed to the state health department as being willing to, support and take on the things that community workers requested there. And that was notably to get vaccines to doctors' offices that serve the Black community, to get local leaders vaccinated publicly. And to really get that message out there, to get questions answered for people, because what might seem like hesitancy in polling might actually just be folks who are waiting to see, have questions about the safety and efficacy and are waiting for a doctor to have the vaccine and to take time with them.
Well, Amy Schoenfeld Walker, thank you so much for joining us and sharing your reporting with us. We appreciate it.
Thank you so much.